How long does a person have to take a medication after they have been prescribed that medication? I'm sure it depends on a case-by-case basis, though.
Well, this is a conversation I have every single day with many patients. A lot of patients, they'll come and they'll have like an encyclopedia of things they printed off from the internet. I call them Dr. Google. But basically they'll say, "Doc, you put me on this medication and it has all these side effects. So I'm just not going to take the medication because I don't want the side effects." But what I do is I say, well, let's push Dr. Google aside. Let's bring Dr. Quinn in so I can tell you the side effects of not taking the medication. And in a lot of cases, these side effects of not taking your medication can be a heart attack or stroke. And what I'm referring to is if you've been put on medication for blood pressure, and you decide you don't want to take the medicine because you don't want to take the risk of side effects, which are very rare. You have blood pressure that's not being treated. It has the potential to be very high, as a patient that I fussed at earlier yesterday. And now he has the potential, a high probability of having a heart attack or stroke. So at the end of the day, if you take medicine, you can have side effects. Normally they're pretty mild, and you'll discuss it with your primary care provider, and they can change it to a different medicine that you might not have that side effect. But if you don't take the medication, then you can have a heart attack or a stroke, and now you're in the hospital or worse. And, it might be too late. So take your medication.
Absolutely. Of course, and check up with your doctor if you do experience those side effects. Now, you already elaborated on this a little bit, Dr. Quinn, but if you can just, again, what happens if a person takes that prescribed medication and they experience those side effects?
Well, as I said earlier, that's why it's so important. A lot of patients, they might call the office and say, "Hey, I need a refill on my medicine." And we'll look in the computer and say, "Mr. Jones, you haven't even been here in like over 6 months. We want you to come in." And they'll say, "Well, why do I need to come in? You know what I take?" And I say, we want to make sure the medicine is safe. So the patient will come in and we'll do blood work. And what we're doing is we're checking for problems with their kidneys, their electrolytes. That can happen if you're on certain medications, to include blood pressure medications. If those numbers are off, then we could change the medicine to something safer so that it won't continue to get worse and they can end up even with kidney failure. But also if you start having maybe some stomach pain, maybe you're taking some medicine for diabetes or fatigue or tingling, you let your doctor know. We can change you to a different class of medications that treat the same problem. And then you can still have that problem treated, but avoid those side effects. But you have to have that communication with your healthcare provider.
Absolutely. Thank you so much, Dr. Quinn. Is there anything else that I haven't asked you that you think would be helpful to this segment?
Well, at the end of the day, as I said, we have to take our medication. We have to follow the instructions of our healthcare providers. We have to keep that line of communications. All my patients have my cell phone and they text me all day, and it's okay because I want to provide that opportunity for communication. Mm-hmm. But the main thing that I want to take home as far as patients understanding is follow your medical provider's instructions. And if you have any questions, talk to them and let them clarify. And if there is a problem, there are other options that they can provide for you, but you have to communicate.
Absolutely. Have that open line of communication and take your prescribed medications. Thank you so much.